Okay, this is part 4 of Critical Thinking in Pharmacology Resources. I just want to show you very briefly how to access the RxTX, and also to show you the RxTX itself and some of the tools that are in there. So here we are on the library web page. Here is the digital resources section. And if you either search for RxTX in the search for databases, or you click on the little R here, it will bring up the databases that begin with the letter R, and at the bottom is RxTX. There we go. My computer's quite slow. So this is what the home page of RxTX looks like. This is the search bar up here, and so you can type in generic names or brand names or manufacturers, all of them, and search for specific drugs. So for example, if I searched for acetaminophen, this would give me a list of all of the different manufacturers and brand names that manufacture acetaminophen. So if you take a look here, when it says CPHA monograph, that's one of those general drug monographs. That's a compiled information from many different sources. Below that, this is Adasol preparations, and this says CPS full monograph. So that's from that is from Church and Dwight, which is the manufacturer of Adasol preparations. So this is information that were sent by this particular manufacturing company, and when it says full monograph, what that means is you'll get the entire drug information, right, from indications to adverse effects, contraindications, etc., etc. You get the whole thing. For some drugs, they don't have a full monograph. They may only have partial information, like, for example, you know, it might be in a different section, even in this case, products for minor ailments, or they might just have supplied. So if you want the full information, then choose a product like Tylenol, for example, where it has a full monograph. So if we just click on that, Tylenol, and let's just choose one of the Tylenol products. So these are all of the different products that are available that are Tylenol, acetaminophen. It gives you a little summary, so how it's supplied, so dosage form and strength. And then as we scroll down in the monograph, it will give indications, so why is the drug prescribed, contraindications, so when can you absolutely not use the drug, warnings and precautions, adverse reactions. There's usually a table right at the beginning that are common interactions, and then they'll have ones that are rare or very rare. Here are drug interactions. There's a nice tool that I'll show you for drug interactions. Dosages and how it's administered, overdose, what to do, special symptoms, how the drug works, so clinical pharmacology, pharmacokinetics, so how is the drug absorbed, where does it go, how is it broken down, and how is it excreted, and what's the best way to store the drug, and how long does it last, and then all of the various supplied, how the drug comes available, in what forms and what strengths. So that's an example of a drug monograph for a particular drug. And as I said, you could search with acetaminophen, or you could search with Tylenol as well, and get the same information. You can also search by manufacturer as well. So this is if you looked under drugs, these are the CPS drug monographs. So that's where if you wanted to look up what are the adverse effects of something, or what is the manufacturer. In this case, the manufacturer is McNeil Consumer Healthcare, for example. There are some other tools that are in the RxTX besides looking up that type of drug information. If we go into clinical info, there are two different tools. One of them is an interactive clinical tools, and here you can look up drug administration in food or drug administration in grapefruit specifically. So let's take a look at drug administration and food. So you can look up a specific drug here, or you can look at the entire table that they have about different drugs and how they should be taken. So for example, here we've got acetobutolol, and it says that we should take that with or without food. Doesn't really matter. Abiraterone, we're supposed to take on an empty stomach. And if you scroll down, you can see all of these drugs and if they've got specific administration instructions. So take them with water or milk or food or nothing. So that's drug administration and food, and they have a similar one, clinical information, interactive tools, drug administration and grapefruit. And remember we talked about how grapefruit juice can interact with many drugs. And again, this is a whole section on specifically grapefruit and different drugs and whether or not they react to grapefruit. So, you know, for example, in this case, diazepam, it says we should avoid grapefruit, and it tells you what potentially could happen. In some, like dextromethorphan, which is a common drug in cough syrups that you buy over the counter, it says it's contraindicated. So, you know, that that has a much more serious effect than simply a precaution to avoid it. Under clinical information, there are also some topics about natural medications, home testing. Here, if we take a look at drug use during pregnancy, if we go to that section, it just talks about what are the principles of taking medication during pregnancy. Here's a table of you know, drugs that we know can be harmful during pregnancy. These are ones that are possibly harmful, and then there's a whole table of drugs that are usually the drugs of choice for different conditions during pregnancy. So that's an example of that topics. They also have a whole section on products for minor ailments. So if you wanted to look up, you know, what could I take to you know, clean my contact lenses, or for minor pain or foot care, then you could look those up. This is an important one, the product identification tool. So in this one, let's say that medication should never be out of its package, but let's say that you found some medication out of its package. You could look up, okay, you could say, well, it is a capsule, and let's say it is an oval capsule, and let's say it is green, and then you could search and it will bring up all of the oh, this one there's no green capsules. Let's say blue. I just want to show you an example. So here are all sorts of blue tablets, and then you could go down, and there are pictures of them, and you could see, okay, does it have an imprint on it? Is it, you know, is it one of these particular tablets that I have found, or can I identify the drug based on these pictures? The Lexi Interactions tool, this takes you to a separate website, but this allows you to enter specific drug names. Let's say fluoxetine. find, let's say, Adderall, XR, and then you ask it to analyze these two drugs to see if there's any interactions. And so this will let you know that yes, in fact, there's an interaction between Adderall and fluoxetine, and that we should monitor that therapy. Sometimes it may say absolutely avoid, it may say consider modification, no action needed, etc. And if you click on that interaction, it will give you an analysis of it, so telling you exactly what's going to happen with that interaction. You can look up under conditions, you can look up therapeutic choices. So these are drugs that are often prescribed for particular conditions. Again, drugs for minor ailments. There's a directory of manufacturers if you need contact information. This is an important one here, the glossary. So you can look up, for example, a glossary of medical abbreviations, and this will tell you what those mean. There's also a section where you can look up Health Canada advisories. So this is a section where you can see, and it's up to date on has Health Canada issued any advisories for particular drugs. Okay, so there's a lot of information in this database, and I think the best thing is to go on the database yourself and play around, find all of the different sections. The online quiz number 3, so for this particular this particular component of the course, you will need to look up information in the RxTX. So my suggestion would be to have the RxTX open along with your quiz, and then you can go back and forth between the two. Be patient with yourself. It takes a little while to get used to finding that information. If you have difficulties finding information, then please come in and talk to me, because you will need to be able to use this resource to look up information. This is the end of Critical Thinking in Pharmacology resources. And again, if you have any questions at all about this material, then please come and see me. Thanks very much. Have a great day.